Katie Dillon of LaJollaMom.com, and we're here today in beautiful La Jolla, California at AcuLife, and I'm sitting here with Julia Sanfilippo, and we're going to talk about acupuncture. I've had a lot of acupuncture.
Good.
And actually, there was a reason why I, started getting acupuncture. Is I moved overseas and I had sinus problems.
Mm-hmm.
And we were living in London. I had acupuncture in London, and then I had acupuncture when I come back and visit the States. And then my husband was transferred to Hong Kong, where acupuncture is just prevalent everywhere. And I was lucky enough while living there that I could have it 3 times a week because of my schedule and because it was cost effective.
Mm-hmm.
And I get a lot of questions from people about it because I swear by it, and that's the reason why I continue to do it.
Mm-hmm.
And because people see or hear that it involves needles, and obviously needles, people have visions of needles going into like skin and it hurting.
Oh yeah.
Or it's just it's like a mental thing, and they don't understand like why people would want to do something like that. And so if you have a client come to you that's totally new to acupuncture and they have kind of the similar concerns, like just about the needles.
A fear of the needles?
Yeah, fear of the needles. Like, how do you kind of walk them through that?
Well, first of all, there's a major big difference between a hypodermic needle, which is what you get at the doctor's office, mm-hmm. and an acupuncture needle. So a hypodermic needle is hollow, so it's basically just like a hole,
Right.
versus an acupuncture needle is solid. And that in itself is a huge difference because
I didn't know that, actually.
Oh, you didn't know
No.
that? So that in itself makes a big difference, mm-hmm. because it's not like a spear going through you. It's solid, so it just kind of goes straight in.
It would puncture you twice.
Right, exactly.
Okay.
And it moves the skin aside and everything. So that's why the hypodermic needle is a lot more painful. Mm-hmm. And then also the acupuncture needles are a lot smaller. So mm-hmm. basically you could fit about 150 or 200 acupuncture needles in the shaft of a hypodermic needle.
Wow.
So it's basically like the size of
mm-hmm.
a strand of your hair. So once I tell patients that, it kind of puts them a little bit more at ease because they realize that it's not as scary, which is why you can put 10, 15, 20 needles in someone, and most of the time patients fall asleep.
And they don't actually penetrate the skin like a hypodermic needle.
No. Well, in a hypodermic needle, if they're drawing blood, they take it from a vein. So I'm not drawing blood, I'm not taking anything out. I'm putting it in different muscles, which feels a lot different than if I was putting it into like a vein, which is, we don't put acupuncture needles in veins.
No.
No, or arteries or anything like that.
Well, you're very good at it because I've had acupuncture from you.
Good.
And like, when you put in the needle, some acupuncturists like twist or tweak it
exactly
a little bit.
Mm-hmm.
And do you do?
Yeah, so basically by stimulating the needles,
mm-hmm.
We just tap it in just to get the needle in. And some acupuncturists stimulate the needles in certain ways mm-hmm. to bring chi or energy to the area. And it depends on what kind of outcome you like, or what kind of outcome the acupuncturist is looking for. So for example, I do a lot of sports medicine type mm-hmm. acupuncture, so I'll do a lot of motor point work, and I'll actually needle the motor point of specific muscles. So I'm looking for a very strong muscle reaction, so I'll tweak the needle to get that kind of strong chi sensation, which will actually relax the muscle over time.
I kind of liken it to how people go and get massages when they have knots in their back.
Exactly.
And that hurts. It hurts. And you want somebody to kind of work
it out. Exactly.
And so whenever I have a needle that, and it actually never hurt. You just kind of do like one of those, but it's like it's supposed to be there.
Right.
If you're feeling a little bit of sensation, it's because you need that needle to be there.
Yeah, in many cases that's the way, because we do a lot of our diagnosis is palpation, so we'll feel along channels, mm-hmm. whichever channel that we think is a blockage, and we'll feel in any sort of tender spots, we call them assure points, mm-hmm. and those are a very big diagnostic tool of, all right, I think we should needle that one. Mm-hmm. So although it may seem slightly uncomfortable, in the long run, it actually balances you out better.
But you do a little massage.
I do.
I know,
after every time.
Normal.
That's true.
That's very cool.
So because I do both acupuncture and massage, it's nice because I blend both in every treatment.
Total sense too.
I feel like it makes it a lot more effective as far as the needles moving stuff, initially opening any channels that I want, and then the massage kind of moves anything else I would want to move.
The other question I get is, acupuncture is not an instant gratification kind of thing. You have to go through multiple sessions and things like that, and a lot of people don't have patience or time. Or if you're working with a new patient, like how do you explain,
the cumulative effects, basically? Yeah. So I do explain that acupuncture is a system of wellness and that it's cumulative over time. So the treatments do build upon each other. It's not that you come in once and then you come in the next week and you're back to where you started. They actually build upon each other. So with each treatment, you are actually getting to your goal. So although they may not be huge effects, although sometimes there are great stories where I get someone right away and it takes them one treatment and they're better, but a lot of times they have to come back. It's for maintenance. It's like
jogging. You can't just jog once.
You can't and expect to be in the best shape of your life. So it's a lifestyle, and that's a lot of people who are attracted to this medicine. They do understand that aspect of it, that it's not just me sticking needles in them. It's them doing stress management and exercise and diet and Chinese herbs.
And do you have a typical client, or is it just all walks?
It varies. So I have people who are, stay-at-home moms. I have athletes who are in high school. I have older people. It all depends, and that's what's great about acupuncture, is that it is for everyone.
And they come in for all different reasons.
Yeah, absolutely.
Good.